used a teledoc urgent care type situation in the past? What's been your experience? Has it been good or bad? I want to tell you the story about a patient I had recently who had come in with what was clearly a gout attack. And this was not necessarily an older person. I think he was in his upper 30s, low 40s maybe. And he'd had both knees swollen, both feet swollen, like at the toes, and was told that he'd had gout in the past and had not had any recent treatment. In fact, he said usually what'll happen is he'll get steroids and the symptoms will go away. He'd tried something like colchicine, hadn't really helped, but he'd never been put on a preventative medication and he had not had his uric acid drawn. And the reason for that is because he had been using telemedicine urgent cares. Telemedicine urgent cares treat the problem in front of them. They don't treat the problem longitudinally. So if he had been seeing a regular physician who had drawn his uric acid, had probably found out it was elevated, put him on allopurinol and decreased that level, he could have avoided the gout attack that led to him seeing me. Now at my visit, I was able to drain the fluid out of his knee, send it to the lab and confirm that he had gout, which had not happened as well because you can't do that over telemedicine. And actually most urgent care doctors live will not do that. And needless to say, so my recommendation to this patient and to you is make sure that you're establishing with somebody who can have continuity of care, ideally a primary care physician, so that they can handle more than just gout. They can make sure you don't have other medical conditions or treat your high cholesterol. But even in this case where you saw somebody like me who's more of a specialist, I was able to give him recommendations and follow it longitudinally and tell him what to do next. There is a place for urgent care. There is a place for telemedicine. There's a place for telemedicine urgent care. But remember, they're only going to serve a small part of your medical needs, and that having continuity of care with somebody who can see you on a regular basis and make recommendations that are going to keep you healthy now and are going to keep you healthy into the future is super important. Before you scroll to the next thing, it would mean a lot if you hit follow so that I can give you more recommendations based on the patient stories I'm seeing.